really doing just a head-to-toe assessment. Hi, my name's Larice Cortez, and I'm doing a head-to-toe assessment, and this is
Tirso Cortez,
and date of birth.
8/1964.
And at the moment, he doesn't have any chief complaints, so I'm really doing just a head-to-toe assessment. So first off, I'm going to ask him a few questions. Any medical history with you?
Yes, I've had knee surgery, elbow surgery, and broke my collarbone.
So
Left knee, right elbow, and collarbone.
Okay, but no surgery on the collarbone?
No.
Do you take any type of medication?
I do not.
Any allergies?
No.
Okay. Not medical history, personal history as far as, do you smoke?
Yes.
Any daily alcohol drinking?
No.
Okay. And then I'm going to ask about your parents. Do you know any medical history about your mom?
My mom's had thyroid surgery for her thyroid for cancer. Yes, she's also had a hysterectomy, and she takes a medication for high blood pressure and cholesterol. Yes.
And probably takes thyroid medicine.
Yes.
You said?
Yes.
Okay.
Mm-hmm.
And your dad, do you have any history?
No, my dad's had knee surgery and back surgery, and he also takes the same medication for
Okay.
high blood pressure and cholesterol.
Okay. And then any physical activity that you do?
I teach spin once a week at EOS Fitness.
Okay. And then do you work?
Yes, I work at SLS. I'm a busser runner, so I run food at work. And
Do you follow any type of strict diet?
no,
Do you drink coffee, water?
I
Are
drink
you a
coffee,
soda
yes.
addict?
5 days a week I drink coffee.
Okay.
And I love
so-
soda too, so yes.
Okay, so not on any type. You eat your fruits and vegetables.
When I can, yes, when it's in
Okay.
front of me.
And then any religious affiliation? Like
Catholic.
Born
Was raised Catholic. Yeah, raised Catholic, but I don't practice it.
Okay, so you don't have any type of diet restrictions due to your religion, or refuse any type of medical treatment?
Nope.
Okay. And I think I've covered everything on the subjective, and at this point I'm going to say his speech is clear, patient's sitting straight and he's poised correctly, he's dressed neatly, his hygiene is clean, his speech is clear, and if I didn't say alert and oriented, ×4. He doesn't appear to be malnourished in any way, and we'll go from there. So at this point, I'm going to start doing my assessment on the head part, and I'm going to put some gloves on, and what I'm doing is touching the head, and I'm checking for any indentation or masses. And you let me know if you feel any pain or discomfort.
Okay.
And here we go. Do you feel anything? I don't feel any indentations or masses at all. And if it were your own patient, a patient in the hospital, you'd probably be checking to make sure there's no skin breakdown. Okay, so at this point, I'm going to check for cranial nerve 7. And so I would want you to clench your teeth. Smile, stick out your tongue, frown, close your eyes, squinch. So at this point I would say cranial nerve 7 is intact. So I'm going to check for cranial nerve 5, and so close your eyes and you just let me know if you feel the soft touch.
Yes. 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 Yes.
So at this point, I would say cranial nerve 5 is intact. And let's see, at this point, I'm going to look at your peripheral vision. So what we're going to do here, I'm going to hold my fingers outside of the field where you'll look straight at me, and you tell me how many fingers you see.
2. 1. 1. 2.
Okay, so the peripheral vision fields are intact, and at this point, I know I'll mispronounce this, but it's the extraocular eye movements, which means it's the cardinal positional of gaze, and I will be testing cranial 3, 4, and 6. So what I want you to do is follow the pin, don't turn your head, follow with your eyes. So at this point, I would say the cranial nerve 3, 4, and 6 are intact. So really quick, I'm going to do, we're checking for, I think it's called Hirschberger test, so it's blinking. So we're going to do that real quick, and if you just look at me, and he blinked as I touched. And again, the reaction was blink, so I would say the Hirschberger test is intact. So at this point, I'm going to look into the eyes, and we're checking for any swelling on the eyelids. Those are intact. His eyebrows are intact. His eyelashes are growing appropriately. I'm going to put on some gloves real quick because I'm going to look at the conjunctiva, and I'm going to look, from what I can see on the sclera, pupils look at 3, bilateral, and are in place. His eyes are brown. The iris is brown, I should say. So I'm just going to pull down on and the conjunctiva is pink and moist. And I think that's it for the eyes that I can remember. So I'm going to go to the ears. And actually I should have left my gloves on, but at this point we'll just put some of this. And I'm just going to feel them real quick. Do you have any pain or discomfort?
No.
Okay, and I don't see anything wrong with the ears. I don't see any masses, any drainage, any unusual type of moles. And they are symmetrical, as were his eyes are symmetrical. If I didn't mention that before, I might have forgotten. So at this point, we're going to go to the nose, and we're just going to check patency. So right now, I just want you to go ahead and just breathe in and out of one nose, the other nose, and just smell for me, and let me know what you smell.
Lemon.
So with this, checking for sensory, I'm going to say this is cranial nerve 1 is intact. One thing I forgot to do was the covering the ear test to check for cranial nerve 8. So we're going to do that now. So if you cover one ear, and I'm going to whisper something, 3 words, and if you can just repeat it.
ABC.
Cover the other ear.
1, 2, 3.
So at this point, I would say cranial nerve 8 is intact. So at this point, I'm going to work on the throat and the mouth area. So looking on the outside, I see his lips are pink, moist. I don't see any cracks or lesions. The gums are pink and moist. I don't see any bleeding or any concerns there. So I'm going to get my tongue blade and gloves again, and I'm going to be checking the tongue, making sure there's no lesions. There's going to be some residue of white. We don't want to see beefy red. I don't want to see any ulcers. I don't want to see any type of growth, discharge. And just let me know if you have any pain. And a couple of things I think I forgot, and I'll get back to that about the mandibular joint. I'm going to make sure that's intact. But go ahead and stick out your tongue. And there's just some whiteness. Tonsils, you still have them?
Yes.
So I don't see any growth or anything on his tonsils. And if you can lift up your tongue, I don't see any in the mucosas. Pink and moist. I don't see any ulcers. His teeth, he has some missing. You can relax.
Thank you.
And the soft and hard mandibular are intact. I don't see any deformities there either. And what I'm gonna check at this point is your uvula, and this would be cranial nerve, I think 12. No. I'm thinking of something else. So at this point, I'm just gonna check his uvula, make sure that it goes up. Say ah. And then gag reflex. So this would be cranial nerve 9 and 10. What I didn't check was cranial nerve 12. So with that being said, if you stick your tongue out, move it side to side, and close your mouth, push on the inner cheek. So at this point, this would be cranial nerve 12, which is intact. I mentioned earlier about the temporomandibular joint. I think that. And this is just checking for TMJ, and open and close your mouth. And I don't hear any type of clicking or grinding. And if that were the indication, was there any pain?
No, not at all.
Then I would be concerned with TMJ. So now we know the tonsils are intact. I didn't see any growth. TMJ motion, we did that. I checked the uvula, so we know the cranial nerve 9 and 10 are intact. So at this point, I'm going to palpate the neck. And I'm doing the pre and post auricular, occipital. And at this time, sir, just tell me if you have any pain. The occipital, the jugulogastric, the submental, the superficial, the posterior, the cervical chain, I forgot to mention, and the supramandibular, I think that's how you say it. And I didn't feel any masses. So at this time, I wanted you to go ahead and take your shirt off. And we're just going to look at his chest and to make sure that nothing concaves. He's not no barrel chesting. He did mention he smoked, so I don't see any of that. I don't see any pulsations, so everything looks even. So with my stethoscope, I'm going to listen for lung sounds, and then I'll count his respirations. But right now, while we're standing here, his respirations are even and unlabored, no respiratory distress. Anterior lung sounds are clear. I don't hear any unusual lung sounds. Adventitious, no adventitious lung sounds. So now I'm going to listen to the posterior lung sounds. Deep breath. Okay, so real quick, I'm going to have you sit down. And real quick, I'm just going to count your respiration. So just kind of relax. And I'm counting about 18 respirations at the moment. So now we're going to go to the heart. And I don't know if I mentioned earlier, I don't see any pulsations anywhere, anything abnormal at the moment around the neck area. So I'm going to go ahead and listen to all the lung sounds, and I'll describe S1, S2, which is the loudest and which isn't. So first I'm going to go to the aortic. And you can just relax. And the aortic, I'm hearing S1, S2. S2 is the loudest. Pulmonic. hear the S1, S2. S2 is the loudest. Herbs point. S1, S2 are intact. The tricuspid. This one, I hear S1, S2, but S1 is the loudest. And then the last one I'm listening is to the mitral. And at this point, this is when you can get your beats per minute or apical pulse and rhythm. And I'm counting about 72 beats per minute, and I don't hear any abnormal heart sounds as far as rhythm, sound sinus rhythm, but that could be verified with the EKG. So at this point, I'm going to listen with the bell, and I'm just checking for murmurs at the aortic. At the pulmonic. Herbs point, tricuspid, mitral, and at this point I didn't hear any murmurs. So real quick, looking at his skin, it's within normal limits for his ethnicity, because he is Hispanic, I think you said?
Yes.
Okay. So down below, I don't see any swelling. His skin's dry and intact. I don't see any ulcers, no edema. Since I'm down here, I'm gonna feel for pedal pulse. It's like +2. I'm gonna do posterior tibial pulse. +2. I'm gonna listen to radial pulse. I would say +2. At the moment, I'm going to go back to one thing, and I didn't look at reaction of the eyes or accommodation. So we're going to do that real quick before I forget. So look straight ahead. Pupils reactive and patent. And then I'm going to do accommodation. Just look at the pin. Accommodation intact. His eyes did cross. And I didn't see any tremors or anything unusual. One more thing I didn't check with the eyes. If you just cover up one eye and look ahead, and I'm just looking to make sure it's lateral. And it is. It doesn't go off in any way. That's intact. Other one. And it's lateral also. So at this point, I'm going to have you lie down, and I'm going to look at your belly. Looking at it while he had his shirt off, I didn't see any scars. I don't see any abnormalities. Go ahead and lay flat. His skin's intact. I don't see any bulges or anywhere, any pulsations. So I'm going to go ahead and put some of this on. And I'm going to listen first. Listen first, because once I start palpating, I'll hear more bowel sounds. So let's listen at 4 quadrants. All fields, all 4 quadrants are positive. I can hear normal bowel sounds, I should say. Now at this point, I'm gonna touch your stomach. I'm gonna palpate it. So let me know if you feel any pain when I do it.
Okay.
Any pain?
None at all.
At this point, I'm gonna do a little deeper palpation. Tell me if you feel any pain.
at all.
Okay, so now I'm gonna percuss. I'm just listening for any dull sounds. Any pain?
Not at all.
Okay, and his abdomen isn't distended, it's symmetrical. I don't see anything unusual. So at this point, I'm gonna have you stand up, sir. And I'm gonna percuss at this region, the CVA region, and when you do this with the patient, you're doing it because you're checking to see if maybe they have a kidney infection. So if you feel any pain when I do this, please let me know. Any pain?
No.
Any pain?
No.
Okay. So at this point, I heard vowel sounds were positive. I didn't feel any masses, nothing pulsating while I did it. So now I'm gonna check neuro. So since he's standing, I'm gonna not go in order, but go ahead and walk. And he walks straight, even. So I want you to do the heel toe. And he's balanced. Now come to me. Now I'm just gonna do, check his neural, if it's intact. I think this is called, just to make sure he's balanced. So close your eyes. You don't feel dizzy or anything?
No.
So that part of his neural is intact. Touch your nose. He's able to do that. Okay, you can stop. Range of motion, if you can do your arms front and back. His range of motion is good. Let me see. Have you sit down. I'm gonna have you with, just follow me with your foot. Just touch the front of your shin like this. And he's able to do that without any problem. And now I'm gonna have you stand real quick and come in front of me, touch your toes. I'm looking at the spine for alignment, and that's intact. Come on, come back up. Now I'm gonna hold your hips, and if you can turn side to side. And that's just checking alignment. And I think at this point, I'm hoping that I got everything and didn't miss anything, and I will end my assessment, and thank you, Mr. Cortez.
Thank you.